Hi guys, it's your girl Jaesbuggin, and I'm back with another episode of What You Working With. Today we will be interviewing a clinical psychologist. This is Dr. Jessica. Say hello.
Hi.
So I wanted to ask you, what is a clinical psychologist, just to get it started off with first?
Yeah, I'm so excited to chat with you today. So, really, a clinical psychologist is somebody that has, at least in the US, a doctorate degree in psychology, and it's really focused on the assessment and treatment of mental illness and psychological problems. And I'm sure we'll get into it, but there's a lot of different things that clinical psychologists can do, from therapy to assessment to research. But yeah, really, the focus is on assessment and treatment of mental health conditions.
Okay, and how did you get started with did you want to be a clinical psychologist, or was it something that you was like, oh, this seems cool? Like, can you tell us your journey on how you became a clinical psychologist?
Absolutely. I love telling this story as we were chatting before we hit record because I went to college
Hmm.
thinking I wanted to be a pharmacist. So I was a
Really?
chemistry major. Yep. I had my whole life plan figured out from like middle school. And then my freshman year of college, my cousin died by suicide, which really
Oh man,
changed
I'm sorry to hear
a
that.
lot. Thank you. It
Okay.
changed a lot of my life, obviously, especially the trajectory of what I wanted to do. And I had to take like an intro to psychology course my sophomore year just to fill some credits. And I was like, I really like this psychology thing.
Mhm.
And so I switched my major to psychology, didn't really know what I wanted to do, but I was like, I want to help people. And you hear that a
Yeah,
lot in the field. Like, I want to
yeah, you
help
do.
people. And so I finished my bachelor's in psychology, and I still don't really know what to do, what I wanted to do. So I applied to some
Yeah.
master's programs to get a
Mhm.
little more experience,
What type of
got
master
in.
programs? Oh, I'm sorry. What type
Yeah,
of
I
master
did.
program did you apply to?
So I did clinical psychology master's programs because
Okay.
I, one, liked research, but
Hmm.
two, knew I wanted to work with people that were struggling with mental health concerns.
Okay.
So I applied, yep, to those programs. And while I was there, I was like, no, that's when I decided I wanted to go all the way, get a doctorate degree,
Yeah.
and really pursue clinical psychology.
Mhm.
And we can chat about this a little more, but I thought I was going to go into academia. I didn't think I was going to do clinical work. I thought I was
Clinical.
really just going to do research, but I don't
Okay.
do that at all now.
So is academia like research? I'm not really familiar with what academia is. Can you just like explain a bit
Yeah.
more for me?
Oh, absolutely. Yeah.
Thank
So yeah, research and wanting to work like in a university setting. So like doing teaching,
Oh, okay,
research,
okay, cool.
applying
So
for
like
grants,
academics.
like yeah,
Academic.
exactly. I
Okay,
thought that's
cool,
what
cool,
I
cool.
was gonna do, and I don't do any of that now.
That's okay. That is okay. So, like, can you just give me like how was it for you? Just because I heard that your cousin passed from suicide, and I'm sorry to
Mhm.
hear that. But was that like your driving force for wanting to like really try to help those out there? But is that like your why?
Yeah, so it is, and it took me a little bit of time to realize that. So after he died, I started volunteering for a nonprofit, Mental Health America. I worked on their crisis line. So I got really involved in mental health, but
Yeah,
I did not think it was going to be my career because I
mhm,
like had this path of like, I'm going to be a pharmacist. This is what I
yeah.
chose to do in middle school.
This
And it
is what
really
I do on
wasn't
the
un-
side. The mental health is what I do on the side.
but it really wasn't until I took that intro to psychology course and loved it. And I was like, is
Mhm.
this what it's supposed to feel like to like enjoy? Because I liked chemistry, but
Yeah.
it also felt like a chore.
You didn't have no
um,
driving force, right? Like it was just like gotta do it, but it wasn't like, man, I really can't wait till next class.
exactly. And my psychology course was like an 8 a.m. So like the fact that I was excited for an 8 a.m.
That's how you
spoke
knew, right
volumes.
then and there.
Exactly. And so that, the love of the course, my lived experience, is really what drove me to do it. And a lot of my research has been in suicide, and I still
Mhm.
work with individuals that are suicidal, but over time, kind of the population and interests that I work with change. But I would say, yes, that's the why, the thing
Mhm.
that pushed me to this career,
Yeah,
even though it took me a little bit to figure that out.
the time. No, I understand that. So can you give me like a typical day in your life of being a clinical psychologist, like from when you wake up to when you lay down? Okay, no, not to when, but when you wake up and when you clock in and to when you clock out.
Yeah, absolutely. So, I want to make the disclaimer I work in a hospital. So, what
Okay.
my day looks like is probably going to
It-
be different than somebody, say, in private practice or somebody in
Okay.
academia. And I'm happy to touch on those as well. But I actually have two roles at the hospital I work at. I work at a children's hospital, and a day and a half a week I work outpatient. So, what my outpatient day looks like is more of what people think of traditional therapy. I see usually
Oh man.
8 clients on my full day, 4 on
Can
my
you,
half
I'm
day.
sorry, can you repeat? I'm sorry, can you repeat it? It
Repeat.
kind of like cut out like yeah,
Oh,
it like the connection had cut out. I'm sorry.
oh, no problem. So in my role in the hospital, I have 2 jobs. So
Mhm.
a day and a half a week, I work outpatient in an outpatient clinic. And what that looks like is more traditional psychotherapy, what people would imagine. Like you go in, talk to a therapist for 45 to 55 minutes, and then leave. So on those
Okay.
days, I just have back to back clients. On my full day, I have 8. On my half day, I have 4. I guess one difference would be since I work for a hospital system, the clinic I work in has like physicians, nurses, so it's more multidisciplinary.
Yeah.
But it's traditional therapy. So I'm working with individuals with depression, anxiety, trauma, the typical things that people think of when they think of therapy.
Oh,
On
so is there,
the other three,
oh no, you could go. You could go. I'll ask after. That's okay.
are you sure?
Yeah, yeah, yeah. I wrote it down. It's okay.
Okay. And then I was going to say, so on the other 3.5 days a week that I'm not in clinic, I actually work inpatient in the hospital.
Okay.
And a lot of people, when they think psychologist hospital, they think of a like psychiatric hospital, but I work
Yeah.
medical inpatient.
Hmm.
So I'm actually working with children and adolescents who are hospitalized for like a medical illness or
Mm,
injury of some type, like a car accident, gunshot wound, things like that. And there, I wish I could tell you I had a typical day, but it really just depends on who's in the
okay.
hospital and who needs me. Exactly.
Yeah.
But what my role looks like there is really providing brief psychological interventions to individuals who are hospitalized because unlike outpatient where I have a long-term relationship with these
Yeah.
individuals, people can be hospitalized for a day, people can be hospitalized for weeks. So really
Hmm.
my focus there is to address any concerns that are coming up related to being in the hospital, relating to their illness, injury, supporting their mental health while in the hospital.
Wow, that's pretty cool. I never knew that, like, especially if, like children or teens where if they was to go through something and like, they get injured or stuff. I never knew that they had a psychologist just to like, be on their side and just help talk to them. That's really good. But I did want to ask, like, so is there a difference between a clinical psychologist and a therapist, or would you say they're the same thing? So like, can you tell me like a major difference? Because like I could hear they're like kind of the same, but at the same time it's like minor differences. So I just want to like, clarify that as well.
Yeah, no, this is a great question. So, a therapist is an umbrella term. So, it's
Okay.
anybody that has a degree in mental health that provides therapy. So, clinical social workers, licensed professional counselors, licensed marriage and family therapists, psychologists, like all of those fields can be therapists.
Okay.
What is different about a clinical psychologist, well, there's a few things. One, the training. So in the United States, to become a psychologist, at least in what's called an applied field, so like clinical or counseling where you're doing intervention, you have to
Mhm.
have a doctorate. There's some states that you can have a master's degree, but for most states, you have to have a doctorate degree. Not all psychologists are therapists, though. So,
Okay.
like I was saying earlier, I thought I wanted to go into academia. So, if I could be a clinical psychologist that only does research and teaching, or I could be a clinical psychologist that only does psychological assessment, and that's one distinction between a psychologist and a therapist because we are trained in the assessment of mental health concerns. So, this could be autism, ADHD, psychoeducational concerns like learning disabilities. It could be severe and persistent mental illness. So that's unique training that we get that other disciplines don't necessarily have. So all of that to say, therapist umbrella term, psychologists can be therapists, but not all psychologists are therapists.
Psychologists are therapists. Okay, that makes sense. Now I get it. That's total sense because I do feel like when it since mental health is something that's becoming bigger, we don't know like all the terms for like, clinical psychologists, therapists, like we don't know all the mental health professions out there at all because it's fairly new, right? Like it's still fairly new. And I think that's great that there's different ones because everybody say they want to be a therapist, they want to be a social worker, they want to be this, but they don't really know like what exactly it is. Like you said, like, you could be a clinical psychologist that just strictly just teaches, like you said, the academia part of it. But the fact that, you could go in, you could have the patients. And so thank you for clarifying that because that's something that's really like important because like not, I didn't even know. So now I know.
Oh, I, no,
Okay.
I appreciate you asking because
Yes.
yeah,
Thank
there's
you.
so many different fields. There's don't even get me started on all the letters after people's names in the mental health field
Yeah.
because that's
BSN. Yeah. Okay. So what?
different. Yeah.
Hmm, so what are the like the pros and the cons of this job? Like I know, like yeah. What are the pros and the cons?
Oh gosh, there's so many pros, I would say. So some of
Okay.
the biggest pros uh, is just getting to see your clients progress, like knowing that you're making a difference, being able to help someone, creating that space that somebody entrusts in you with some of their, hardest, most challenging times.
Yeah.
I think for me, working in a hospital, I love the interdisciplinary approach. So, getting to work with people of other disciplines. But I know
Mhm.
even if I wasn't in that setting, I have a lot of friends that are also psychologists or other types of therapists, and like that sense of community is
Yeah.
wonderful. Yeah, I mean, those are the main pros that come to mind. Cons, and I think every mental health professional will say this, note writing and paperwork is probably
Yeah.
the biggest con, or dealing with insurance. That's the other
Yeah.
downside. I will say something I hear from a lot of my friends who are in private practice that have my
Mhm.
job. A con is graduate school doesn't prepare you for like really going into your own like business, which I think a lot of mental health professionals in general are starting to do that.
Mhm.
Being their own boss, having flexibility, things like that, which I guess is a pro as well. It gives you the flexibility to
Yeah.
kind of create your schedule, niche down your clientele. But I have heard from a lot of my friends who are in private practice that graduate school doesn't really prepare you for how to do that. So I can see how that's a
Yeah.
con. And the only other con that comes to mind, which is a pro as well, but it can be really hard. Like the work can be really hard. Sitting with hearing stories of trauma,
Yeah.
death of clients is something that you're never prepared for.
Yeah.
And just having to navigate, like, how do I be present, care for my clients, but also care for myself when I'm
Mhm.
hearing And in many
Ye-
instances, you might be the only person that knows these things
Yeah.
about them, and that's heavy.
Yeah, I agree. Wow. It seems like it's like a reward, because like, you're helping people out, you're making sure that you're the listening ear for you, and especially if you see them progress. But then the downfall is sometimes, it is hard knowing that you have to listen to this, and it's like, man, I wish I could do something, but you just have to listen and be that. So I could understand how that's hard to listen and then try to how is that going to intertwine with you? Like you got to make sure you have that like I guess I forgot the word. But you just have to make sure you keep it where it's at and try not to let it affect you as much because you still have to,
Hmm.
be your live your life as well without letting that take you. So I understand that it can be a
Hmm.
lot, but I just want to thank you for like doing what you do because there's not a lot of people that have, the strength to, listen to people every day and try to help them or their mental health may be taken over. And it's like, man, I don't think I could do this. I just want to thank you, for doing that and being
Oh,
there for your clients that you have been with. So yeah.
well, thank
Um,
you. Yeah.
you're welcome. So then I wanted to ask, how has this career shaped you as a person?
I would say tremendously. And I know that's a very broad statement, but one thing, I mean, I'm going to say one thing and it's probably going to turn into a million things
That's
that
okay.
it's really let me do is I have had the privilege of working with so many individuals from such different walks of life than
Hmm.
I have, whether that be racially, ethnically, socioeconomically, just different lived experiences. And it's really opened my eyes to not only like the inherent privilege that I hold being a white middle class female and
Hmm.
deconstructing a lot of my beliefs and things that I was raised with, but also just like opening my eyes to so many, I don't know, injustices or just like things that I would have never even considered because, like we were talking about,
Yeah.
sitting in that space with someone, it's sacred in many ways. And you're hearing
Yeah.
these things, whether they be horrible traumas or even just like wins, because we love to hear those in therapy too. We love to hear the good things in therapy as well. And I think just having the privilege of sitting with so many different people from so many different walks of life has really allowed me to become a better person, a more empathetic
Yeah.
person, challenge my previously held beliefs and
Mhm.
worldview. And I learn something from every single person I interact with, whether
Yeah.
that is I meet them one time in the hospital or I've been seeing them outpatient for years. Like they all have a story to tell, and I get to be part of that story in such a
Yeah.
small way, time wise, but big way in other ways. And I think, I don't know, just all of that has really impacted me as well.
Mhm.
Especially, I didn't say this, I live in the South. And so there's a lot of sociopolitical stuff that goes on that
Yeah.
directly impacts a lot of the clients I work with. And it's, I don't know, just made me a better advocate. I think it's made me a better human. It makes me look at things differently.
Yeah.
Sometimes it's hard to turn off like the psychologist brain when I'm not being a psychologist and just have to be Jessica. But yeah, it's impacted me tremendously.
That's good because sometimes like some people jobs they just like stress them out a lot and they don't see no personal growth. But the fact that that you see personal growth from it and you can see how, like you said, it kind of changed some of your beliefs, it opened your eyes up. It to me what it sounds like it made you more like open-minded about certain things where it's like wow, you really have to like have an open mind and really see like expect the unexpected kind of thing where it's like wow, I would have never guessed that. So that's good. I'm glad that I was able to, like you could just feel good that you see things in a different light and you're able to like advocate and help others as well. And like what would
Absolutely.
if you had a student come to you one day, I know you don't teach but I'm just saying like like a student that's, like they're in school, like what would you tell them? Like, I want to be a clinical psychologist. I don't know where to start. Would you recommend them getting a mentor? Like, what would
Oh,
you recommend? What type of personality would they have, or what type of attitude should they possess in order to, like become the best clinical psychologist they could be?
I love this question so much. So I love the
Oh,
idea of getting a mentor. So
mhm,
I do some mentoring with college age students that want to go into the mental health field. And
mhm.
first question I always ask them is like, why? Why do you want to go into this field? I also, this wasn't exactly your question, but I do like to explore with them like, do you need to become a clinical psychologist in the sense of getting a doctorate degree? Or would
Yeah,
a degree in, like, say, social work or counseling more suit your goals? So we talk about goals. But say we talk through all that, and then somebody's like, no, I definitely want to go the clinical psychology route. I want to learn assessment. I want the opportunities for research, all of those things. Talking with people in the field to see what they do. Like, I've shared my job and experience, but there's so many clinical psychologists that do things very different than I do.
yeah,
If they maybe want to gain some more experience before applying to grad school,
yeah.
gaining experience in research, or even just like if they can get a job at a private practice, whether that be working in the front office, or like a lot of psychiatric facilities may hire somebody with a bachelor's degree to be more behavioral tech. So just getting more experience
Mhm.
researching different programs because every program is going to be different. Do you want a program that is in a certain location? Do you want a program that has professors that research a certain topic that you're really interested in? And then yeah, during your graduate program, you do get a lot of different opportunities for more like
Mhm.
clinical work and research and things like that. But yeah, I would say interviewing people in the field to kind of look at the different options. If you have a professor, that's usually a good place to start. Like if you're taking
Yeah,
psychology courses in undergrad, talk to them, say if they have any recommendations of you know, jobs or research opportunities, things like that. And yeah, I mean, it's very worthwhile. It's a long road. Like getting a doctorate is not an
yeah,
easy feat, but I always say it's so worth it if it's something that you're passionate about. And also know that there's so many opportunities. That's one thing I love about my degree and my field. There are so
mhm,
many opportunities. So, like I said, I thought I was going to go one route. I thought I was going to work with one population, and now I'm doing something completely different.
yeah.
So just keep an open mind, I guess would be the last thing.
Keep an open mind. Okay. And would you say like, what about like the qualities the student should possess, or it doesn't matter about what type of personality? Like, what would you say about that?
Oh, yes. Yeah. No, thank you for reminding me because I know
No.
you did ask that. So I think if you're going in the mental health field in general, whether it's to be a clinical psychologist or social worker or counselor, you need to have empathy.
Yeah,
I do think you need to have openness because the reality is you are going to work with people that are different than you, hold different
yeah,
beliefs, have different outlooks, different lived experiences. And it is not your job in the mental health field to change those
yeah,
beliefs. And so I worry when people are very closed off or closed minded trying to go in the
yeah,
mental health field because you are going to work with people and share that space and that very vulnerable space with individuals. With regard to clinical psychology, this isn't necessarily a personality trait, but you have to like research if you're going to get a doctorate
yeah,
because that's just part of it. So, I guess along with that, like organizing, being conscientious, like those type of qualities
yeah.
can help if you're doing those type of things. But yeah, definitely having empathy and openness. I mean, there's different personalities across the board, but those two things I would say are probably the most important.
So the two things, just empathy and openness, right?
Yeah.
Okay, good. And um, oh my God, where's this question? It was just in my head. Okay, okay, yeah. So what's one piece of advice, like one piece of advice that you would give anyone who just like, yeah, just what is just one piece of advice that you would give to anyone, whether it's regarding mental health, whether it's regarding like wanting to be a clinical psychologist, like just what is one piece of advice that you would just give that you want the world to hear?
Ooh, that's a big question.
Right?
I mean, I guess a general mental health piece of advice to anybody that, maybe listening and struggling or things like that, like take time for yourself. Like it's okay to take time for yourself, take care of yourself. Life throws a lot at you, and it's okay to slow down and take care of yourself. With regard to advice for people that are interested in becoming a clinical psychologist, I kind of already said this, but just to repeat, like talk to people in the field, get a sense
Okay.
of what people do and what their jobs are like, because at the end of the day, there are a lot of opportunities. There's a lot of variation in the field. And if you think you want to do this and then you start talking to people and you're like, actually, that doesn't sound fun. Maybe, a career in social work
Mhm.
more aligns with my values or who I am, or maybe, you know, a career in something else. So I would just say, talk to people that do this as a job and figure out all the opportunities and what is it about the field that you like or would want to do, and is that an option for you?
Yeah, well, thank you. I agree with that advice as well because there's nothing like networking. Like there's nothing like just, talking to people and putting your name out there and you never know what you could find. You never know who you know. You never know who they know that could help you, elevate to the next step of helping you with your life or who you want to become or what you're trying to do. So I definitely agree with that. And also just taking time for yourself too because we're always so worried about like our everyday life and everyone else that we forget about ourselves, and that's one of the main things that I'm going to say that's one of the main things that I forget is to always just like take time for myself or do this for you. Like I'm always worried about helping everybody else, so this advice is for me too. Now thanks. And
You're
my
welcome.
$1 million question that I love to ask everyone, I just want to know that is the money worth it? You could just say yes or no. That's it. And that's how you don't have to go in there, but that's my last $1 million question that I ask everyone because I just want to make sure, you're working and the money is paying right.
I love this question. So I would say for me, the money is worth it. I will make the
Okay, good.
disclaimer, most people don't go into mental health to get rich, but
Right.
for me, I live very comfortably with my
Mhm.
salary and my job.
That's good.
And yeah, at the end of the day, like nobody's gonna do a job for free.
Nope.
But
Unless
yes,
it's volunteering.
for
No.
no, exactly. For me, the money is worth it. Can't speak for everyone, but for me, it is.
That's good, and I'm glad to hear that. So now you put in all that hard work, and it's coming back to you too. Like it's coming back to you double. You helping out, you seeing the progress of your clients, but you're also getting paid at the end of the day. So it's a win-win, right? No,
Yep.
no, I just
No,
want to
and
thank you. Oh,
that's a great question.
yeah,
So,
thank you, because I just have to make sure. I want to make sure I know what I'm getting myself into. If I know, like maybe I want to do that, like. But yeah, I just want to thank you for joining what you're working with today. It was a pleasure talking with you about being a clinical psychologist, and I hope this episode helped a lot of people out, and I hope that, I hope you enjoyed my presence as I enjoyed yours, and I can't wait to talk to you in the future as well, too, okay?
absolutely. Thank you so much for having me on. This was great.
You're welcome. And if you know anyone, please let me know. I will be like so happy to interview them about whatever they do. It doesn't matter.
Absolutely. I can send you some people.
Yes, please. Okay, thank you. Bye.
Bye.